without any further ado, I will hand over to Joe, who will be your first presenter for today.
Hi, thank you very much, Kaylin, and welcome everybody to the second webinar by AFM on COVID-19. A few minutes whilst I connect and share my screen with everybody. The issue about PPEs has become a growing concern with COVID-19 since it began. And the appropriate use of the PPEs has even become a more growing concern. If you don't have enough and we're currently not using it appropriately, then it doesn't make it worthwhile for now. So the presentation focuses on the general use of PPEs, and then we'll look at some of the critical points that you should note when you're talking about the use of PPEs. I have no conflict of interest to declare. So a worldwide problem. COVID-19 is now a worldwide problem. It's in almost every country around the world with very high numbers, as we saw in Europe and Italy. Now currently the United States, you can already see that China now has very little numbers. But all over Africa, we have cases that are rising. Ghana currently has over 2,000 cases of COVID-19, and worldwide we've now reached over 3 million cases. So making sure that this is not something that we will have to downplay in any way. So what are PPEs? The first question is, what are PPEs? This question keeps recurring because it's always been seen as the full gear people wear, and the thoughts that comes to mind is people remember how they saw people when they were doing the Ebola management. So full PPEs being sprayed with chlorine at every step. But PPEs are just every special covering designed to protect a health worker from exposure to infectious agents. So these include your gloves, your face mask, and so on. But looking at the hierarchy of control, how you can control risk, PPE is actually the one at the bottom and is considered as the least effective. So the availability of a PPE is not as good as putting in all the other measures to control the risk of getting the disease, such as probably elimination of the hazard entirely, which in that case is not possible because the hazard is being borne by people that have to be taken care of and they cannot be eliminated. Substituting the hazard is also not possible, but engineering controls such as barriers between taking a history from a person rather than sitting right in front of the person, and then all the administrative controls, the processes for triage, the processes for pre-triage, the processes for donning and doffing are all as important, with the PPE being the lowest on the pyramid. So do we know our PPEs? Do we know the PPEs that we're supposed to have? Can we identify them? So we all know our N95 mask, our surgical mask, the gloves, the waterproof gowns or overalls, and then the eye protections. What PPEs will you need? If you are working in an institution where you have likely cases coming in of COVID-19 or have some positive cases, what PPEs do you need? Before you decide, you would need to look at what duties you're going to perform. So perform a risk assessment or a duty assessment. What am I going to do when I get to the place? And make this a routine. If I'm going to do a procedure, then I'll pick the PPEs that match it and so on. I would go through the various different procedures and which PPEs you're expected to use as we go along. But if you did have the PPEs, then the question is the administrative control. Do we know how to put it on and take the PPE off? So we're going to start with the guide. So these guides should be available and readily in your facility. They should be in the facility for people to be able to easily refer to it and easily follow it whilst they are getting ready to get in an infectious area or out of an infectious area. For the donning, the first one is we would have to make sure that you do your hand washing. So perform hand washing, and then afterwards, your gown goes on first, depending on the type of gown that you are using. Then your face mask will continue, and then you put on your eye protection and then your gloves. The number of gloves that we would use, it's usually preferred to have more than 2 so that one will serve as a skin and then can be changed frequently as you are moving from one patient to the other. The doffing location, what I'm sure the design of an isolation center will be discussed in a different webinar, but there should be a separate location for your doffing of your PPE. And when you get there, you first remove your working gloves. So if you had 2 gloves, that would mean that you still have a second glove on. You carefully remove the gown following the procedure, ensuring that you're not touching the outside of the gown whilst you're doing it, but trying to remove it from the inside. You go ahead to remove your eye protection, and then you remove your mask last. To keep this in mind, the most important part is that after every single one of the procedures, so take off your first gloves, you go ahead and do your hand hygiene. You remove the gown, do your hand hygiene, remove the face shield, do a hand hygiene, and then remove the mask, do a hand hygiene. And we all remember that the hand hygiene should be 20 or 30 seconds with all the procedures that we're supposed to know for hand hygiene. We also wanted to look at droplet control, and we already discussed this in full. So the procedure of putting on your mask and the need for PPEs for routine care for patients with suspected COVID-19. So if you are doing routine care, then your N95 or your FFP2 is not required. This means that you are only considering droplet precautions, and we're not talking about aerosol generating procedures. In this case, a normal medical or surgical mask is recommended along with your goggles, your gown, and then your gloves. But in the minute we move to having aerosol generating procedures, and our aerosol generating procedures could be suctioning the patient, intubation of a patient, if there happens to be a chance that a CPR will have to be done, vigorous turning of a patient, and some others, then it would mean that your mask should be replaced with an N95 or FFP2 or an equivalent mask. So there are different gradings of the mask depending on where it is made, but any of them that are equivalent to an N95 or an FFP2 is what is recommended for airborne precaution. So this picture shows some 2 pictures of an N95 or an FFP2, and then your eye protections. Very, very important. Having them, as we already discussed, is not as important as knowing how to make sure it's being used appropriately. So with this, we'd want to go through the fitting of an N95 mask. So you need to check the seal before you enter a room that you think has a suspicion of a COVID-19 case or has COVID-19 positive cases. So when you have the mask on, you can see from the diagram, you hold the mask in your hand, you cover it over your mouth, and then raise your straps one above your head at this level, and then the other one goes just below your hairline at the neck level. Hairline is very relative, I'm sorry, at the neck level. And then with this, you now check for a positive seal. So you exhale sharply, and then you find out whether there are leakages of air above the top of the N95. If there is, you have to readjust the metal strips there, and then you try the test again. If there continues to be a leakage and you think that it's the mask itself that has a problem, kindly ask that this mask is changed for you. So we're going to go through a few other areas where you can use a mask. We already talked about going in to see a suspected case or a positive case where there's no aerosol generating procedures. So you go in with your gown, face shield, your mask, but then you do not bother yourself too much about an N95 if it's not available. N95 are required for aerosol generating procedures. But if you're at a triage or screening area, you ensure that you have at least 1 meter maintained between you and then the patients that you are screening. And if that is in place, then no PPEs are required. It's advisable, yes, if you have your scrubs, you'd be in your scrubs for this. But then if there's not going to be any contact with the patients at all, with a 1 meter apart, asking the questions for the screening, then no PPEs are required. The other angle is for our cleaners in our health facilities, who would be cleaning the isolation areas, the holding areas, and the treatment areas. So they would have to go for a medical mask, gowns, and then they have to wear heavy-duty gloves. So this is supposed to avoid the normal gloves getting torn and then exposing them to any injuries. Wear the gum boots and then eye protections for the risk of splashing of organic material or the chemicals that they're using to clean. So a few general rules about precautions of wearing your PPEs. Always perform your hygiene before and after use of the PPEs. Actually, keep ensuring to perform the hand hygiene always. The minute one after each procedure, you go ahead and perform your hand hygiene. So before putting on the PPE, always inspect it to make sure that it's not compromised, the PPE has not expired, and then the sizes that are there are appropriate for your size. Then do your risk assessment before selecting the appropriate PPEs for your patient's care. What am I going to do in the room? Am I having the right PPE for that? And then dispose of your PPE carefully. And then if it's a PPE that cannot be reused, you should dispose of it immediately. If it is reusable, then you go through the thorough disinfection of the PPE in between use. The other thing we need to think about here is that once the PPE is on, the patient activity can commence and the PPE cannot be adjusted or touched. Very important. So if you wear the PPE and you go into a room, you need to ensure that it's very comfortable, it's well placed before you go in. Because if you touch the PPE, if you're touching your face at any point whilst wearing the PPE to adjust your mask, it then puts you at a high risk. If you need to overly adjust or you need to really touch it, you might have to doff, come out, and use a new PPE, which would mean that one PPE would have gone waste just because it wasn't fitted well. And then always do the doffing very carefully. You might have gone in and are doing the doffing. That is one of the critical points that you can reinfect yourself. So careful doffing when you are taking off the PPE is very important. This diagram just shows the rational use of the PPE and then the minimum needs. So the minimum needs is for PPE is trying to avoid the use of PPEs entirely. So using telemedicine to evaluate suspected patients. Would we be happy to receive phone calls from people that said, I think I might have COVID-19 infection? Go through the screening tool with them on phone, and this prevents physical contact. Then the use of physical barriers to reduce contact with the COVID-19 virus itself. So glasses between you and the clients you are speaking to, or plastic windows. And then restricting the number of workers that come into a room. If you're not supposed to be in a room with suspected cases, don't be there. That restricts the number of people that are using the PPEs. The other end of it, so to the right of the screen, it goes over the PPEs you would use for general care, for aerosol generating procedures, and then among the general public, they are advised to wear a mask. And down the slides, we'll talk about the use of cloth mask. So some precautions in our African setting, and this is supposed to be a resource limited setting. Now, we actually do not have, everybody is resource limited when it comes to PPE use. So in this, we're looking at the ways of extending the use of our PPEs in order to fit the period that we're in, where PPE availability is really low. So for the medical mask, try and extend the use for up to 6 hours without taking it off when caring for patients. If it obviously becomes wet or it becomes soiled, then it would have to be changed. But if not, try and use a medical or surgical mask for as long as you can use it for. And in order to enhance its use, you can actually put on a cloth mask over the surgical mask, and this can help. But the cloth mask alone should not be used by health workers in an area where we have suspected COVID-19 patients. Then for your respirators, your N95 FFP2 and 3s, extend the use for up to 6 hours without taking it off whilst caring for the patient, and then go through the disinfection techniques. These techniques have been outlined by CDC, WHO, and other recognized authorities on how to sterilize an N95 mask to make it available for use again. And this is for when there's critical need for it. For the gowns, cannot be reused if it is removed in a manner that contaminates the entire gown. If it's a cotton gown, then the laundry service can be used to launder it using chlorine and soaking it in a large drum of chlorine, 0.05 chlorine, for about 30 minutes, rinse it, dry it in the sun. It should be ironed before it is reused. For the goggles and face shields, that is one of the ones that are really easy and to use. So to reprocess them, clean them with soap, detergent, and water, and then with 0.01 chlorine for about 10 minutes, rinse in water, dry them, and then have them ready for use again. So the issue has been going around, and everybody is insisting you should wear a cloth mask. And currently in Ghana, there's a slogan of if you don't have a mask, you can't enter an institution. And a lot of the institutions are really taking this up. So the general public are being advised to use the cloth mask. It's to note that there's a clear distinction between the cloth mask and the N95 mask. And the cloth mask will help protect people who possibly have the case, prevent it from giving it out. And if you are wearing it, it prevents obvious droplets from coming into contact with your nose and your mouth. This can be encouraged in a lot of countries, and then the method of sewing it has been shown on CDC's website and other authority websites, so anybody can look at it. And in extreme cases, the CDC has considered bandanas and t-shirts as masks, which as much as possible we should avoid till we've reached the most extreme cases. A lot of the countries have also put in measures to verify the type of mask that you're using. And in Ghana, the FDA is looking at the people producing the mask and verifying the quality of the cloth mask for the general public before the cloth mask is used. So how to wear a cloth mask? Let's share this quickly. So place the mask over your face and you tie it behind your head or use the earlobes to make sure that it is well fitted. Then do not touch the mask whilst you are wearing them. So if you accidentally touch the mask, you make sure that you go through some hand hygiene, either sanitizing or wash your hand, and remove the mask entirely, remove it away from your face, wash it immediately after removing the mask. And then you can have various masks, so change them as regularly as possible, wash them, dry them, and then iron them. A few tips for when PPEs are running out. We've already realized that there's no way we can have enough PPEs, and this is all around the world. Everybody is running short of PPEs. So maximize the engineering controls. If you remember the pyramid that I showed, the engineering controls have more effective use, and then stick to the administrative controls that have been set in by your institution. Then cancel all non-urgent procedures and appointments in your facility so that the few PPEs that are left are not being used for non-urgent procedures. Then reserve the PPEs for health workers and places where they will be needed most. So if it's the isolation centers, the treatment centers, as versus other places in the hospital that will not require N95 masks, those should be appropriately arranged. And then reusable PPEs should be processed. So our facilities should be considering how do we sterilize and reuse some PPEs beyond the point where we have none else to use. Reusing of the PPE. So these are some of the few steps for reusing the face mask if you have to. Make sure you perform hand hygiene, avoid touching the inside of the mask whilst you are going to wear it. Visually inspect the mask to make sure that the integrity is great. And then as usual, check for the seal after you have put on the mask. So there's a new term that I found yesterday whilst going through the readings for this, and it's called the PPE burn rate. So this is when you put in the amount of PPEs that you're using within a day, compare it to the ones that were used the previous day, and then compare it to the number of patients that you have, an average number of PPEs used per patient. And all of this, the link here, and this can be shared in the chat room very soon. The link here can give you access to an Excel document. If you put all of this in, it's able to tell you how many PPEs you expect to use over a period of time. And this can help in planning and purchasing if that's an option. So this is how the graph looks like. Gives you a nice view of the the day, so day 1 up to whichever day that you are doing the calculation for, and then the various types of PPE with their sizes. And then when all of this is done, it can plot a graph for you showing you the trend of your PPE use and how you would need to, how and when you would need to replace the PPE based on the stock that you have put into the document. The very important part is the risk assessment after you have used your PPEs. All of this risk assessment is in view of appropriate use of the PPEs. And I'll take a few minutes and go through the risk assessment. So the first thing you'd want to do is find out whether you're in direct contact with a confirmed case of COVID-19. And if you were in a COVID-19 ward or an isolation ward, that is obviously a yes. Did you have face-to-face contact in less than within a meter? That would be yes if you were taking care of a patient. Were there aerosol generating procedure? So if you answered yes for any of this, it meant that you have been exposed, you were in an area where there was an exposure of COVID-19. Now, if you were in your appropriate PPEs, this does not put you at risk. So you come down and follow the rest of the trend. So during the interaction, were you wearing your PPEs appropriately? That is your gloves, your medical mask, your surgical shields, your eye protection, and your disposable gowns. If this is a yes, and then it goes on to ask, how often were you doing it? Were you doing it all the time, or it was often that you were wearing it or rarely? If you can't answer that you were using it all the time, that puts you at a high risk of being able to have contracted COVID-19 by being in an exposed environment. If you also did aerosol generating procedures, then it adds on whether you had an N95 mask. And if it was used all the time, then you know that you were not at risk. But if it was used most of the time, occasionally or rarely, whilst you're in an exposed environment, then you'd consider that you could have been at high risk. And then you also look at splashes or accidental body fluids coming in contact with your bare body or any mucosal surface. If that is a yes, that also puts you at high risk. If any of these were no, then you'd be at low risk, recommending that you do not need to consider isolation, 14 days isolation after exposure. All of this is based on the appropriate use of the PPEs. And this should always be considered even before you walk into a room when you're going to see patients. The last thing I will talk about is keeping our loved ones safe. So post-shift decontamination. There are quite a couple of health workers who have moved away from their relatives in order to ensure that they're keeping them safe within this period, since they are always in contact with patients that are positive. If this is possible for you in your setting, that is recommended. If it is not possible for you in your setting, you would have to go home at some point. One thing we'd want to avoid is wearing our scrubs from home and wearing our scrubs back home. That just allows us to transfer infections in and out of the hospital too easily. So don't let us wear our scrubs from home and then right after work, have clothes that you can change in. So remove your uniform and change into your own clothes before going home. Hand washing after every procedure whilst you are at work, and then definitely hand washing and drying just before you leave for the other home. If your hospital has a laundry service, then your uniform can go to the laundry service for it to be laundered. If not, you put your uniform in a plastic bag. When you get home, you wash your hands again, disinfect your car handle, your steering wheel, if possible, and then put your clothes, your uniform directly into a washing machine. If it can wash at a high temperature, that's fine. If not a washing machine, any way of washing it by wet, warm or slightly hot water, and then it should be dried out in the sun and then ironed when done. The plastic bag that was used to carry your uniform should be discarded. And then one important thing is we carry a lot of items to work, or we used to carry a lot of items to work. The advice now is to limit the number of items you carry to work. So if you do not need a bag at work, if you do not need your laptop at work, those are things that you shouldn't be carrying to work. You might obviously be carrying your phone to work and your car keys. Ensure that you wipe down your phone. And then, if possible, take a shower at work before you leave. If not possible, try and take a shower at home and do all of this disinfection before we go and take the hugs from our family or come into close contact with our family. So in summary, we talked about, we identified the PPEs, we looked at the pyramid for control of risk, and noticing that PPE use was the least of them, with a lot of engineering controls and administrative controls that would help protect you. The proper donning and doffing of the PPEs, how to wear the N95 mask, ensuring seals, what PPEs to use during which procedure, and then also we talked about the care that you'd have to do when you come home to protect your family. Thank you very much.
Thank you so much, Joe. That was wonderful. While we are waiting, if any of the participants have questions for Joe and his presentation, please go ahead and drop them in the question and answer panel. But in the meantime, we are going to test out a feature where poll question. We are just interested in getting some of your feedback. Great. And Steve, are we able to wrap the poll? Oh, there we go. Yes. So it looks like most of you would say that you don't feel that your previous training on PPE has adequately prepared you for COVID-19 response, which is very interesting. And then we had another poll question for you. So if Steve could share our second poll question, we're interested to know, especially if you don't feel that your previous training has adequately prepared you, kind of what further resources and information you would be interested in receiving related to PPE. So for that question, we'll go ahead, and it's a free answer, so please go ahead and share your answer.
I put it up in the chat actually. Thank you for a great presentation and all the recommendations. My question to Joe is, with the fact that potentially COVID is not going to go away in the next 6 or so months, it's going to be a while before it's cleared off. Is this our new normal? Is this how we're going to be working in the ED? Are these PPE recommendations a permanent feature? What do you think?
Thank you very much, Ben, for your question. So I think the message for ED care will have to eventually change. Our procedures in our ED will have to change for some point. We don't know when COVID is going away, but then we don't know what other infectious disease is coming up next. So the processes we have put in our ED, we would have to find the balance between merging those processes with our regular ED care and finding a nice balance in between that in order to continue managing COVID patients, but also to be able to perform our normal ED activities. That's my thoughts. I could take thoughts from anybody else too.
We might ask Joe to answer this question. It's about recommended ways to disinfect and reuse face masks like N95s and FFP.
Okay, so both WHO and CDC have come out with some recommendations to autoclave, N95 and FFP mask. The caveat to this is that there are lots of ifs based on what material was used to make it. So you can just check on the WHO website and then also on the CDC website. It would give you a nice list of recommendations of how to disinfect the N95 mask. For the face shields, the recommendation has always been to wash it with soap and water and then use 0.01% chlorine for that. For the N95 and the FFPs, the recommendation is, because if you touch it with water, then it means it's just gone. So to try and autoclave it, but then there are all recommendations about the type that you can use based on the type of material. So kindly check the CDC and WHO website for the exact details which would pertain to the type of material that you have.
I think, Joe, did you also want to make a comment on the private sector?
So it's quite admirable, the efforts of the private sector in the fight for COVID-19. The government made it possible for a lot of public-private partnerships, and a lot of the private sectors have really stepped up to this. We currently have a COVID-19 test kit that was developed by a private individual in conjunction with the the local university, the Kwame Nkrumah University of Science and Technology, with support from the Ghana Tech Labs and then the MasterCard Foundation, where they produce a test kit, which is actually now under review with the FDA to see its sensitivity and specificity before it is rolled out. Also, private sector has been big in the construction of an isolation center in Accra, the capital. They're working, and it's a public-private partnership to get an isolation center. Private sector has been very, very phenomenal. I think in Ghana, we would have to really commend them for their efforts. Thank you.
Thanks, Joe. There's also a great question that asks specifically for low resource country settings, what is a safe alternative for use for PPE? And I think you may have touched a bit on this in your presentation, but if you can maybe just speak again on alternatives to PPE if you have an incredibly low resource setting, maybe don't have access to some PPE resources.
Baseline is to make sure that you're safe. You would need to make sure that you are safe in order to see a patient. If you're only going to add up to the number of patients, that just definitely does not help. So if there are no PPEs and it's a very unsafe environment and there's no alternative, you try not to get involved with management at that point, because that's going to leave you infected and just add up to the number of infected cases. I talked about when you run out, or when you realize that your PPEs are about to run out. So even before you run out, we should put in measures to reduce the use of the PPEs. If you're not needed in the room, don't be there. Try and put in barriers so that there's no physical contact between you and patients that don't need physical contact between them. And then the local manufacturing of PPEs is something that can be looked at instead of the overall that you would wear. If you have a cotton stone overall, that can be worn, and then also a waterproof apron can be worn between that and then your scrubs, in order to ensure that there's no body fluids that would get onto your scrubs or your work clothes. That is one possibility. And then sterilization of this has already been mentioned, is soaking it in chlorine 0.09. I think stands to be corrected, I could check that. Soaking it in chlorine for a period of time, for 30 minutes, washing, putting it out. And then for the face mask, the use of the cloth mask is somewhat effective, but not for strict hospital settings, especially for aerosol generating procedures. So if we can save the use of the cloth mask for non-urgent care, then we can have some available for care. But always do your risk assessment. If there's too much risk related to your procedure, based on the PPE that's available, contact your immediate supervisor and find a solution to it.
Thank you so much, Joe. And I just want to be aware of everyone's time. We appreciate it. All of you have given us a full hour of your day. I know everyone is very busy. So there's a few lingering questions that you have posed to us as participants. A few of them I think would be great for us to dive in deeper on in future webinars, specifically some questions about lifting of lockdowns and what that transition will look like. So we will take that back to our office and hopefully get kind of a more thorough answer. So please continue to share your questions if you have them here. You can always also contact us at programs@afem.info. And then I just wanted to mention before we close today, a huge thank you to both Joe and Ben for presenting and sharing their wonderful presentations. We will make those available online on our AFEM website on the resources page. And with that, we'll also include a lot of the resources that were mentioned today. So the PPE burn calculator. I think I also saw a disinfecting of ventilators link. So we'll make sure those are all available in one area and send them out in an email. The last thing we'd like to ask is we have a survey here. I'm going to drop it in our chat function. If you could take a moment to answer about your experience today and the topics, it would be hugely helpful. So thank you everyone so much. As always, we appreciate you making the time, and we will see you next week.